Medical Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Alzheimer's disease risk increased in those with early menopause and later start to hormone therapy, finds study. A new study led by Mass General Brigham researchers sheds light on the relationship between the risk of Alzheimer's disease and age of menopause and use of hormone therapy or HT. The results indicate that early age at menopause may be a risk factor for AD dementia, but that women who were prescribed hormone therapy around the age of menopause onset did not show increased risk. Buckley and colleagues used positron emission tomography or PET neuroimaging to study how the presence of two proteins involved in AD dementia, that is beta amyloid and tau, related to age at menopause and HT use. The researchers used data from the Wisconsin Registry for Alzheimer's Prevention, one of the few longitudinal studies on AD dementia that includes detailed information on menopause and HT use as well as PET neuroimaging. They analyzed PET scans from 292 cognitively unimpaired adults to determine levels of amyloid and tau in 7 regions of the brain. Tau, which is known to be present in greater quantities in women compared to men in these brain regions, was a primary focus of the investigation as its presence may offer insight into the sex-specific aspects of AD dementia and the risks that postmenopausal women may experience even before they begin to display symptoms of cognitive decline. Higher than usual lithium levels in potable water may raise autism risk, shows study. Pregnant women whose household tap water had higher levels of lithium had a moderately higher risk of their offspring being diagnosed with autism spectrum disorder, according to a new study led by a UCLA health researcher. The researchers, who analyzed lithium levels in 151 public water works in Denmark, representing the water supply for about half of the country's population. To identify which waterworks supplied mothers' homes at the time of their pregnancy, the researchers used address information from Denmark's comprehensive civil registry system. Using a nationwide database of patients with psychiatric disorders, the researchers identified children who were born in 1997 to 2013 and compared more than 12,000 diagnosed with autism against 63,681 children who did not have an autism diagnosis. The researchers also controlled for maternal characteristics, some socioeconomic factors, and air pollution exposures, all of which have been linked to increased risk of autism in children. Study shows moderate exercise to be safe for people with muscle pain from statins. Statin therapy does not exacerbate muscle injury, pain, or fatigue in people engaging in moderate intensity exercise, such as walking, according to a study published in the Journal of the American College of Cardiology. Researchers sought to compare the impact of moderate intensity exercise on muscle injury in symptomatic and asymptomatic statin users plus non-statin using controls. Symptomatic versus asymptomatic was determined by the presence, localization, and onset of muscle cramps, pain, and/or weakness using the Statin Myalgia Clinical Index score. Researchers also examined the association between leukocyte CoQ10 levels on muscle injury and muscle complaints, since statins may lower CoQ10 levels and reduced levels can predispose people to muscle injury. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.